This is the Dental Up Podcast, brought to you by Keating Dental Arts, a full-service, award-winning dental laboratory. Each week, you'll learn tips and techniques from real-world dentists, bringing you in-depth interviews, motivating stories, current events, and sports. Here's your host, Sean Keating.
Hey everyone, Sean here. Welcome to another episode of the Dental Up Podcast. Our guest this week is dedicated to providing exceptional patient care by keeping up to date with the latest research, technologies, and advancements in dentistry. She is a graduate from the University of Nevada, Las Vegas, where she received her Bachelor of Science in Biology and her Doctor of Dental Medicine. Practicing from Reno, Nevada, please welcome Dr. Jennifer McClanahan, DMD. How's it going, Dr. McClanahan?
I am good. Thank you.
I know how busy you are. I know we got only a little bit of time on your lunch, but man, I can't thank you enough for your time and, just taking your time out of your lunch to come and talk a little bit about, your journey in dentistry. So, I always start off a little bit talking about sports real quick. And I know you guys got a stadium being built out there, huh?
In Vegas, we do.
Yeah. So, how far are you from Vegas now?
So Reno is about a 7-hour drive from Las Vegas. So it's closer latitude-wise to San Francisco, and Vegas is closer to Los Angeles. So
Okay.
yeah, people often think that we're closer together than we are.
Yeah, I'm a knucklehead. I should have noticed that. It's like, yeah. So what about with you with sports? You like anything going on, football or baseball or anything like that?
I can't say I'm a diehard football fan, but I do enjoy it. My husband's really into it, and my family. It gives us reason to get together. Growing up in Vegas, we didn't have a lot of sports teams. I was born in Houston, though, so football was a big part of my life when I was little. My husband's a Raiders fan, so I jumped on that bandwagon, and just so happens they are going to be in Vegas, which is good because I can go down there when I visit my parents. And
Absolutely.
check out some games.
That's so cool. Yeah, I go to Vegas with me and my wife every once in a while, but just flying in and seeing it being built, it's kind of crazy. And then on the other aspect, coming into LA, you got that stadium being built by the Forum, for the Rams and the Chargers. So pretty neat. I'm a big football nut too. I was watching that game last night. They had a doubleheader on Monday Night Football, so they had two games, and they had the Jets playing, and heck, the first quarterback is a rookie. Yeah, he threw an interception the first play. Yeah, it was like, what the heck? And then the Rams came on later. It's like they didn't come on to like 7:30, but man, watching that first series, Oakland came, drove the ball all the way down, scored, and then the Rams came out in 3 plays. They had a punt, and I'm like, what the heck? And I kind of an early bird going to sleep, so I kind of went to bed at halftime and woke up. My wife's going, you're not going to believe it. They won. And I'm like, yay. So kind of cool. But, it's just, I'm glad it started up again and we can give us something to do and watch the football and see how the teams are going to, do. I'm looking forward to the Rams doing good. But, well, I'll shut up about sports and let's dental up. So tell me, doctor, why did you get into dentistry and at what point did you think I want to be a dentist?
So this question, obviously I've been asked so many times, is not really anything super inspiring. I didn't know I wanted to be a dentist until I was actually a senior in college. I just knew growing up, my mom flew for Pan Am. My parents got divorced very young, so we lived with our grandparents. And at a very young age, I was kind of brainwashed to go to college and have a career, like be a doctor, or a dentist, or a doctor or a lawyer. A dentist really wasn't in there. My mom never finished college. So I kind of just went on this track to have a career and be able to be independent, take care of myself. And medicine, I've always been fascinated with medicine. So I got into that and got on the track for pre-med. Wasn't until you obviously have to do a lot of hours at the hospital, volunteering, getting into it, which is great. And I think it's really good that they do that because that's what made me realize that I really didn't want to be a doctor. I got all the way through and I'm finally in my senior year and I'm studying for the MCAT and I'm working with all these doctors and thinking this is really depressing and you can't make an impact really quickly and a lot of it's patient compliance. So I decided to switch tracks. I was already doing some research and I thought about maybe becoming a professor, getting into research. My advisor suggested dentistry. And so I shadowed some dentists and I thought I really like this. I love working with my hands, and it has the medical component, and I kind of feel like I was fated to be a dentist because I love it and I feel like I'm good at it, and glad I'm here.
Oh, that's so cool. What about with college? How was it going to dental school? Any positive things that you remember, or any things that kind of just bugged the heck out of
Uh,
you?
uh, Dental school, I mean, it's like going through hell. I'm sure most professional programs are. I met my husband there. We didn't date until 3 weeks before, and we often joke like if we got together earlier, we probably would have broke up just because it's so stressful.
Yeah.
You meet a lot of really good friends. You know, meet a lot of people you don't like because I think it's an environment where you just kind of see everybody
Yep.
in their best and their worst situations. So you kind of know everybody really well when you get out and know who they are as a person. But I did make some really good friends. I have some friends that live up here in Reno, and still a couple in Vegas, and I'm good friends with their wives and things like that. So it was an overall very good experience, and they teach you how to deal with stress. I think they try to break you on purpose so that you can deal with that in your practice.
No kidding. Now, was your husband, did he go to dental school, or he was just going to college there?
He went to dental school with me.
Oh,
So
okay.
he actually went to undergrad at University of Nevada here in Reno.
Okay.
His dad's a dentist in Fallon, Nevada, which is about an hour east of Reno. And he went to UNLV Dental School, and that's where we met.
No kidding. So is he
hmm
practicing at a different practice than you, or is he practicing with
He
dad? Or?
does. He practices in Sparks at Champaign Family Dental.
Okay.
And he's been there since we graduated. We graduated in 2011, and he started there right out of school. And I started here at this practice January of 2012.
No kidding. What a trip. That's cool
hmm
how you guys you're both
hmm
in it, man. I mean, I got some guys that are husband and wife teams, and they can kind of get at you, working, seeing them every day
Yeah.
in, day out, but
hmm
sometimes it works
I could
good.
imagine.
Yeah, sometimes like
I
doing
think we could probably do it, but we both like where we are, and it's nice to have your separate life. So we just stick with it.
Absolutely. How cool is that? So tell me about the practice
hmm
you're working at now. I think you kind of start off in like Austin, Texas, didn't you? After graduating, you spent some time
Yeah,
practicing in Austin. Tell me a little bit about that. That sounds pretty. I got some friends out in Austin, man. It's a pretty cool place.
it is. It's a cool place. So I was born in Houston. I have a lot of family in Houston. My sister is there, and I'm really close with my sister. So in dental school, it's kind of my goal to end up back in Texas afterwards. So like I said, my husband and I, we knew each other, but at the time, we really didn't start dating until 3 weeks before school was out. And I already had this job lined up in Austin. And then they said, I'm going. I'm not going to change my plans. That seems really silly. We were just flying back and forth, seeing each other, and just got to the point where somebody had to move. And if you know anyone from Northern Nevada, you know that they never leave here. So it was me that had to make the move. And I did. And it was a great move. It was the best thing I ever did. One of our friends that works up here knew that he was an associate for another dentist here, and he was moving back to Elko, and she was pregnant, so she needed somebody as she was going to have to be on maternity leave soon. And I sent over my resume, set up an interview when I got back into town, and I started working here. It was the first place that I interviewed at, and put in my resume, and I got the job, and I love working here.
No kidding. You've been there for a few
hmm
years now, haven't you? 5 or 6 or?
Yeah, about 6.5.
No kidding.
It'll be 7 in January. Yeah.
That's awesome.
So
So tell me a little bit about the layout of the practice. How many doctors are working it and how many ops you got going? And tell me a little bit about that if you could.
there's 2 doctors. The owner is Monica Lee, and she was a graduate from USC in 1999.
Okay.
And she's the one that hired me. I'm still an associate. And so just the 2 of us. We have 5 operatories. We're not a big practice, but we are very busy, which is good. We're looking out until about March right now for new patients with cleanings.
Ah,
Because,
you're kidding. That's so
yeah,
awesome, man.
yeah, so
Booked
it's
out till
good.
March. It's only September.
Yeah.
You guys got to raise.
Doctor time's a little more available, so we're not crazy. But yeah, because we're only 5 operatories, we have pretty much 3 full-time hygienists working, and then we each have a chair, so we just work really efficiently, and
That's
that's
so
how we have
cool.
to do it.
That's
Yeah.
awesome. What do you think about someday maybe start your own thing, or maybe you and the hubby do it, or you kind of like it the way it is
Well,
right now?
nothing's ever off the table. We're both in really good relationships with our jobs right now. But I've had jobs in the past, and you never know what's going to happen with relationships. So we never take anything off the table, but as of now, we're very happy where we are. So
No, that's cool. What about like I remember going to Reno. We go to Reno and then we fly into Reno and then we just drive to like Lake Tahoe. Are you close to
hmm
Lake Tahoe at all or no?
we are. So my office is actually on the northwest side of Reno,
Okay.
and so we're about 25 minutes from Truckee,
Okay. Perfect.
maybe 30, 40 minutes from Tahoe. And then I actually live down south, so we're really close to Mount Rose and Tahoe that way. About 30 minutes.
No kidding. I mean, they got the greatest ski
That's one
resort.
of the best things about, it's the best thing about Reno. That's the accessibility to Tahoe. It's
Oh,
really beautiful.
absolutely. So tell me, what kind of procedures do you like doing and what don't you like doing in dentistry? I mean, do you like crown preps? Do you do endo? Tell me a little bit about what you like and what you don't like.
I actually do a little bit of everything. I don't place implants, but I do surgery as far as extractions, immediate dentures. I'll do some tori removal, alveoloplasty. I do mostly fillings and crown and bridge, though,
Okay.
mostly restorative. I do some removable. I do restore implants. I've done some removable, or implant retained removable stuff. I do root canals. I don't do molars anymore. I did a couple out of school, but it's just not really worth time, the
Yeah.
time investment. So I refer those out. But I would say I don't really have a favorite. It just really depends on the case. I like doing fillings. I like making a difference, like in an hour, and just making, fixing a hole in a tooth or fixing a broken tooth. I like the instant gratification of dentistry. That's probably the best thing about it, because you can make people happy in 30 minutes, fix a problem for them, educate them. And that's just something you can't do in a lot of jobs. So.
Absolutely. And especially too when we start doing some of those cosmetic anterior cases, just the way their face lights up and just the joy and how you really can change a person's whole just appearance and attitude. And it's the neatest thing in the world, man. So what's been your guys' marketing strategy there? I mean, do you do social media? You work in the public sector? Tell me a little bit about that if you could.
So right now we just go basically off of patient referral, and then people find us on their insurance plans. We don't do a lot of outside marketing anymore. I know that my boss, when she started, we would do mailers, and we still go to occasionally some of the they're like kind of job fairs, or not job fairs, but vendor fairs and things like that around. We're close to a Del Webb community.
Okay.
So we go up there, things like that, just getting out, meeting the pharmacists in town, just getting to know everybody. But mostly now, because we're a smaller office and we're getting busier, most of our marketing is just from patient referral, which is the best way to do it anyway.
Absolutely. No, that's and it's free. You just take care of your patients and treat them good and do good work, and they'll tell people, and look at you guys are so busy. The next thing you got to do is just raise prices. that'll calm it down a little bit. Hey, time to raise prices.
Well, we do take a lot of insurance, and so your hands are tied with that. But we think of that as providing good service to the community. And that's really our goal. So these people who have insurance, they work hard every day and do their job. They deserve to have good dentistry too. So.
Absolutely. You sound like a saint, Dr. McClanahan from McClanahan from Ireland. Are you Irish? I take it.
I'm a little of everything, actually. So.
That's so cool.
Yeah.
Now I heard you're going out. Your husband's going hunting this weekend, and you're going out to Vegas with Mom.
My mom's coming here from Vegas,
okay.
So I'll be here. But yeah, my husband's going hunting. So.
No kidding. Well, girl, you got to take her down to Reno. They got casinos there, baby. That's pretty fun. we don't
spend much time in the casinos, but
yeah, it's neat.
It's not really my thing. The gambling. I've worked in a lot of them. I know that people, they're so beautiful because people don't win all the time.
Oh, I know.
And stay away from that.
It's me, and I'm not the big gambler anymore. I used to love it. Oh, play blackjack. And now me and my wife go, I might play for 20 minutes out of a 2-day trip. And the whole thing with me is just the attractions, the activities, just the different shows, shopping, go to Caesars and, it's just really neat to, I don't know. And I think 70.
There's so much to do.
Yeah, and the food is so freaking good. I'm a big eater,
Yeah.
and I'm a foodie. And Man, I just love going there.
That's the
Just
thing I miss the most about Vegas is the food. We left there and I was like, they're getting better in Reno. They've really improved since they've been here the last 7 years, but they have a long way to go. It was nice. You could just go anywhere and have a really great meal, and yeah, some of the
yeah.
best food in the world.
What do they call Reno? The biggest little city or something in the
That's it.
biggest little city in the
Biggest
U.S.
little city.
That's so cool. Yeah, we used to do this thing. My friend owned a pizza parlor over in Irvine where our kids grew up and we lived, and he'd do it once a year, and we'd do a bus. We'd get a bus, like a tour bus, and get like 40 of us guys, and we'd do a trip down to Reno, man. It's like, what the heck?
Oh.
And we'd go and we'd be back the same day. We'd come back that night, and
Oh,
it's just
really?
like, I remember one year I went there and literally got there. We left at like 6 a.m, got there like noon. And by 12:30, I was out of money. It's like, what happened? I'm like,
Yeah, that could happen.
yeah. And I'm like, man, let's get out of here, dude. And it's like, I had to wait till like 8 o'clock at night before he left and got home at 1. But yeah, that gambling, it's a reason like those things are all built, all those beautiful, shiny buildings, because the people's money, man. And gambling can
Right.
be, a lot of people have issues with gambling. My mom and
Yeah.
daddy taught me, when you go to Vegas or you go gamble, you bring the money that you expect to lose. And if you lose it, you don't get any more. And you just got to go with that attitude. And I've always done that. Like, you bring $500, and if you lose it, and that's, you kind of, you don't have
You think
expectations.
of it as a expensive arcade, but yeah, don't have expectations to win. That's a healthy way to gamble.
Exactly. And I've always, because, too many people, I need this, I'm spending my rent or this. No, you go there with what you expect to lose. And if
Right.
you have that mindset, you'll be fine. But that's just,
Yeah.
certain people are wired
Really
differently.
sad.
Yeah. And they're
Yeah.
like trying to sell
Addictive.
their firstborn, man. I need it. I need to get the baby diapers. And it's like, no, dude, you should have stopped way ahead. But you had a couple friends that were just a little bit too much into that. But yeah, it's it is what it is. But hey, so tell me a
Yeah,
little
it
bit
is.
about CE. What do you do for continuing education? Do you do any conventions? Tell me a little bit about that.
Yeah, I do go to some conventions. I'm actually a standing member of the Nevada AGD board, which
Okay.
is the Academy of General Dentistry. So me and just 2 other board members, we organize CE here in Reno. There isn't a lot that comes through Reno. There's a lot that goes to Vegas, and there's a lot in San Francisco and things like that. But so we put together probably about 5-6 months out of the year a monthly meeting and we bring in speakers and just have a CE here that we do. And also I'm in the ADA, so I try in the NNDS, which is the Northern Nevada chapter of that. The Northern Nevada ADA chapter also has monthly dental meetings, so it's another way to get CE. And then obviously the big conventions every year, I try to go every few years, and that's pretty much how I get CE.
No kidding.
And I do a lot of just online magazine ones too.
What about
Mhm.
what's the latest piece of equipment you guys purchased at your practice?
Oh geez, we just got a new intraoral camera,
Ah, beautiful.
but we've had some in the past, so nothing new. It's just a little nicer, and
It's nothing
yeah.
like showing them cracked amalgams and kind of going in the mouth. I remember way back in
Right.
the day when those came out and just going in there, and my dentist showing me, Sean, look at all these amalgams those Navy dentists put in your mouth back when you were a youngin',
Right.
and they're just cracking that whole enamel all the way down. But yeah, it's
They are
amazing.
really neat, and we do a full set for every new patient too, and it's good for us just to have a baseline too of what their teeth look like, and so we can follow things as time goes by. But it is a lot of people are like, wow, I didn't know that my teeth looked like that. Or
Yeah.
that you can show them the plaque on their teeth and stuff like that. That they swear they're brushing properly, and they're like, oh, you're missing this spot. They're like, oh.
I can
So
see
it's
that.
a great tool.
No, it totally
Mhm.
is. And that's kind of neat with like the new scanners they got for impressions. I mean, you can go in the mouth and kind of show it to them in a 3D, format and kind of tilt their head around. So down the line, I could see
Mhm.
you guys maybe getting into some of that. Have you thought about any impression scanners or any kind of CAD
We
CAM?
have. I prefer old-fashioned impressions. I know a couple people who've used the scanners, and they seem like they have their learning curves as well. And
Oh, they
I just
do.
feel, you know, I just feel like if, you have something that works. I have very little adjustments to do in my crowns with the way I do impressions, and the patients, don't seem to mind. We have quick setting materials now that they don't taste terrible. So I just don't really see a reason to switch. I actually talked to some lab techs that said they oftentimes will pour up the dye anyways. So if they're having to go through the step of pouring it up just to scan it, I don't know. It doesn't seem very.
I've been doing your work for a while now, and I'm looking at a case for you, number 5 Primo, and you got some sweet impressions, man. They're very crisp. So it does work, and that's just the way we've been doing it, man. But nice wash and just freaking real crisp on the margin, and yeah, man, that's just keep doing what you're doing, baby, because it's good. And how did you hear about our lab? How are we doing as a lab? We doing okay for you?
Yeah, you're doing a great job. I actually first heard about you at one of the ADA conventions, and I think that one was in San Francisco.
Okay.
I think it was a few years ago. We had been working with another lab a lot, and they were doing a good job for a while, and then they got bought out by a much larger corporate lab, and things were just getting a little iffy, and the quality wasn't consistent. So I had all of your information still, and just decided to try you out, and ended up switching over. So.
Oh, man.
And then my husband really loves Dental Town, and he said that you were also mentioned there as a favorite lab. So, I mean, this was after I switched, but
yeah, I love your husband too. Is that dude sending me any work? We got to get his work.
Yeah, he does send you stuff. So.
Oh, that's so cool.
Yeah, we just have different last names.
Oh, okay. We'll have to get him on a podcast too, man. I'd like to pick that guy's brain, man, especially where he's going to go shoot this weekend. What's he hunting for?
He's hunting a deer, muzzleloader tag.
No kidding.
Kind of the old school way of doing it.
Yeah. No, that's so
But
neat.
he does all the weird tags so he can actually get them. He does archery and muzzleloader and rifles.
Oh, man, that's so cool. It's kind of like Ted Nugent. Ted Nugent does that bow and arrow stuff, and he's a total hunter. I'm sure he's not like Ted. He doesn't look like Ted Nugent's old, too.
I don't know who that is.
Hey, Cat Scratch Fever, baby. That's like, he's a rock and roll dude. But that's what I grew up with. But it kind of ages me there, But no, that's so cool.
No.
So what kind of advice, I know you're kind of new out, but you've been in the trenches for a while now. What kind of advice could you give some of our newer dentists that are just starting out?
I mean, just basic advice is just treat people well and don't let people treat you poorly. I feel like that's the biggest thing. And as far as that goes, it's jobs, patients, don't let them walk all over you. But it's really easy to get kind of pushed around, especially when you're new grad and you have tons of debt. By office managers and things like that, and you just have to try to make good decisions, and it's hard, but sometimes not to make good decisions, but to not get pressured a lot when you're relying on your job. But just remember that the best thing for quality of life and happiness is just to feel good about what you do every day, and to make sure that people are treating you well too.
That's always it's a golden rule, always treat people how you want to be treated, but then I've never really heard it say, well, make sure that, they're treating you well, because sometimes it's, you're working with people, it's tough, and there can be some cranky people. There's a lot of people are kind of cranky, and some can be miserable a little bit. And, but to hold your own against that, and, it's got to be a tough thing. And
but sometimes you need to let them know. And especially with patients, a lot of times, they will respond very well and change their behavior. So.
Hey, I just want to thank you so much for coming on board the podcast this week. And if there's anything we could do,
thank you for inviting me.
Oh, anytime. And you and your husband got to get out when you're in Southern California, man. You got to come by the lab and see your techs. And we'd love to take care of you. Send you over to Disneyland, send you out to the beach, whatever you guys want to do. We'd love to have you guys out. And we appreciate all the work and everything that you guys send. And if there's anything we could do, please let us know.
Okay, well, thank you.
All right, Dr. McClanahan, have a great day, and have a great weekend with your mom this weekend.
I appreciate that. Thank you.
All right, doctor. Thanks a lot. We'll talk to you real soon.
Bye-bye.
Bye-bye.
Thanks for joining us on the Dental Up Podcast Show this week. Make sure to follow us on Facebook, Instagram, and Twitter, or search the Dental Up Podcast on iTunes for our weekly feed. Don't forget to visit KeatingDentalArts.com/promo for exclusive offers. Keating Dental Arts is a full-service dental laboratory, and we're nationwide. We'd love for you to send us a case so we can show you the Keating difference. If you dig what you heard, please leave a review on iTunes, and we'll be back next week.